The first food aid trucks have made it to Ethiopia's northern Tigray region since the signing of a peace deal. Half of Tigray's 5.5 million people need food aid, with many of them reportedly starving. Earlier this month, the warring sides, Ethiopia's government and the Tigrayan forces, signed a ceasefire agreement 2 weeks ago. The move put an end to a 2-year conflict, which led to thousands of deaths and warnings of a famine. There had been no international aid going into Tigray since August, when an earlier ceasefire broke down. Well, for a little bit more on this, we're now joined by Jude Funway, who's the spokesperson for the International Committee of the Red Cross in Ethiopia. Thanks very much indeed for joining us. This is welcome news, I guess, that the first line of humanitarian aid is finally getting through to Tigray.
Thank you, Peter, for having me on the program. Indeed, it's a moment of relief for the people who are living in Tigray at this point, because it's been a very difficult 2 years for them during the conflict, and this comes as respite to the population in northern Ethiopia, specifically in Tigray.
Health issues are something that you see. What have you been able to see and access up until this time that requires urgent attention?
The situation on the ground is dire. Our colleagues on the ground are reporting a very difficult situation where most of the hospitals on the ground have completely run out of basic medicines, for instance, painkillers, antibiotics. Our colleagues have been telling us about a situation where they visited hospitals and found medical hospital staff going out on the streets to get white clothes from people as donations to be able to use that as gauze to treat wounds. They're reporting overcrowded hospitals. It's a dire situation out there where pharmacies are depleted. We have thousands of people who have remained without food, thousands of them who have remained without medical care, and we're having a situation where diabetics, cancer, and HIV patients cannot even access prescribed medications.
With poor and very little nutrition, all kinds of medical problems are presenting, I would imagine.
Yeah, it's a very serious situation then, and that explains why our medical supplies that have arrived in the region already, we are doing an assessment in collaboration with the Tigray Regional Health Bureau to be able to prioritize, because the humanitarian needs are huge compared to the aid that has arrived in the region so far.
All right, so with this opening up, how quickly do you think you can start assisting and maybe even, if I can use the word, normalize things in Tigray?
So far, we have sent in our first convoy went in on Tuesday. We are hoping to send our first, to airlift our first humanitarian supplies by air, hopefully tomorrow, because we had a test flight yesterday to the town of Shire. We had to start with a test flight to test for technical and logistical reasons, because that's the first time that a humanitarian flight is landing at that airport in the last 2 weeks. So we are hoping that with the humanitarian air flights, aid would get into the region faster, especially the urgent supplies. We are also planning at this point to send in another convoy, a much bigger convoy, in the next few days. So we are really trying to send in as much as we can to be able to respond to the needs in the region.
Are you worried that this peace deal could break down, because they've done so in the past?
Look, we actually welcome and we appreciate the efforts that have that the parties have undertaken so far to facilitate the delivery of humanitarian aid. And we are really hopeful that we are going to be able to continue our deliveries on a regular basis.
All right. Do you have any idea in terms of numbers? You know, we've been using quite a lot. What's your assessment in terms of people that are in critical need?
At the moment, it's difficult to say how to tell you the extent of the needs because, of course, while we are delivering humanitarian supplies, we are also continuing to make an assessment of the situation because, you know, it's been quite some time that we did not have access to every part of Tigray. So at this point, we are trying to make an assessment because we are trying to assess the needs. To be able to have a proper understanding of what is needed, where, and so that we can be able to provide to the people in the areas that are in greatest need.
I'm wondering about access because there are large parts of the country that probably rural people have been fleeing, fighting. Are you able to reach far and wide places where there's probably a lot of need?
Of course, the access, we just gain access into the region. So we have not been able probably to get to every part of the region. We are gradually trying as much as we can to get into those areas. And like I said, we are working together with the regional authorities, for instance, to be able to deliver the medical supplies that we sent in a few days ago. We are working with the Regional Health Bureau to assess the needs, to identify the hospitals that are in critical need. Based on the assessments, then we are going to provide them with these medical supplies. So it's and also to clarify that even during the active conflict, the ICRC maintains its operations in the region. So our colleagues have been working in the region even during the active conflict, despite the difficulties that they were facing. So for us, it is not it's not new again that we are working in the region now. So we have remained in the region. We have maintained our presence in the region. So we are just going to scale up our response at this point because we have been in the region providing emergency response even during the active conflict.
I'm always concerned about children in times of crisis because they seem to be a little bit more vulnerable. And I just wonder what some of the issues that you've been seeing that are particular to children.
Yeah, you know, part of our work as the ICRC is to reunite families that have been separated. And of course, you know, when children find themselves alone in such a situation or in such a context, it becomes even more difficult for them. So we have been trying as much as we can to reunite families and in a situation where it's possible, okay, when it's safe, when it's desired, we try to bring these families together, including children. But we continue our assessments to understand the needs while we are delivering this aid. And then, of course, children are the most vulnerable, which means that we are going to them on our priority, they're on our priority list to make sure that they get the needed humanitarian assistance.
All right. I mean, there are things that we take for granted, like immunizations and things like that. And I wonder if these programs are going to be salvaged now, because I'm sure that there's been a lot of vulnerability just because you haven't been able to get these things across.
Yeah, like I said, it's a difficult situation. So what's important for us now as a humanitarian organization is to make sure that people do not continue dying, is to make sure that people get the basics that they need to survive, that they get the medicines, that they get the food that they need at this stage to survive. Of course, in a longer term, we are as time goes on, we are going to look at more sustainable and resilient solutions to see how we can help these people to recover from the damages that they have experienced over the last 2 years.
All right, Mr. Funway, we're going to have to leave it there, but thank you very, very much indeed. And we wish you the best with the work that you're doing, the important work that you're doing. Thanks for your time.
Thank you for having me, Peter.
Okay, all right, that's where we'll leave that. That was Jude Funway, who's a spokesperson for the International Committee of the Red Cross in Ethiopia. Humanitarian aid finally being allowed to get through, even though the ICRC had been able to have some operations still in that troubled Tigray region. They're now able to scale up their activity to help hundreds of thousands of people that are in need.